morning everyone. I am Dr. Meenu Gupta. I am radiation and clinical oncologist and I am member of the Indian Society of Neuro-Oncology. Today is the World Brain Tumor Day. That is the International 8th of June is the World Tumor Day, Brain Cancer Day. तो इसी पर हम थोड़ा सा कुछ एजुकेशन एंड टीचिंग एक्टिविटी कर लेते हैं. तो लेट्स डिस्कस अबाउट द ब्रेन ट्यूमर फॉर अवर इंफॉर्मेशन. एंड इफ वी आर टॉकिंग अबाउट द बर्डन ऑफ कैंसर, you can see the burden of cancer in our country is quite large, and if we are talking of the Indian population, it contributes 18% of the total world population. And most of the population, 30% of our country population of pediatric is it is not very less. It is approximately 38 crore. If we talk of the almost USA population, so we are populated country. And today I will be discussing about the pediatric brain tumors. So overall incidence of childhood cancer is 38 to 124 per 100,000 population per year, and we are detecting at least 15,000 to 75,000 new cases. We are talking of the pediatric population, so every 100 new cases every day in India. So the type of pediatric, the most common childhood cancer in our countries, we know that leukemias are almost 28%, and CNS tumors, they contribute 21% in pediatric or childhood cancer. So if I will be discussing about the childhood cancer, these cancers are actually very aggressive. If we compare with the adult cancer, they are actually very aggressive. They grow very fast, and sometimes the causes are not known. While in adult we know the various lifestyles, their genetic factors, but in case of pediatric population, sometimes causes are not known, but they are mostly curable in all stages. We are talking of the childhood brain tumors here, but if we discuss about the childhood cancer, mostly they are curable in all stages. And with this positivity, let's discuss a case. So I am going to discuss a case of a 4-year-old boy who presented with the gross motor delays and presented with there was the wide-based gait, headache for 1 month. He was irritable, having lot of headache, vomiting, and lack of social interaction. You know, sometimes children, they are going to the school and they are more close to the teachers. They can observe such kind of symptoms. But here, for an old boy with the irritability and lack of social interaction, vomiting. So, this boy was presented to the clinic, where the investigation of choice was the MRI brain was done. Here you can see the cursor. There is a MRI brain. It was showing some lesion in the posterior fossa. We can see there are lot of lesions, can be the low-grade glioma, sometimes lymphomas, astrocytoma, but most common in pediatric population is the medulloblastoma. So this child underwent the imaging, and we have to think about the differential diagnosis of this such type of the brain lesions. So what can be the differential diagnosis? As I told, definitely it can be some gliomas, and most common are the medulloblastomas. So what can be the next step? How to proceed with such type of the children, and what emergencies can be there, investigations or confirmation. So I will be talking more about the specific treatment. Once this such type of pediatric population presenting with such masses, we have to actually reduce the symptoms of raised intracranial pressure with the corticosteroids and other routine investigation. So this is the Brain Tumor Awareness Month, and I will be straightway coming to the medulloblastomas, the management of medulloblastomas. So this I think we can see these slides, and yes, the Shubham can help me from yes. So medulloblastomas, but as I show this child, you have already seen the images with some lesion in the brain. So this was actually diagnosed as the medulloblastoma. What are the medulloblastoma? Medulloblastomas are the brain tumor that are usually located in the cerebellum, and actually this is the area which controls the balance, coordination and other motor function, and they constitute 15 to 20% of childhood brain tumors. As this child presented, most of these tumors they presented with the headache, nausea, there is an imbalance and problems with the motor skills. So we can see these are the symptoms of mostly headache, nausea, vomiting, irritability, ataxia, gait ataxia. These are the usually symptoms. And recommendation, as I told, I am the member of the Indian Society of Neuro-Oncology, and various international members are there in this society, and they have recommended their own guidelines as per the Indian perspective for Indian children, right? So MRI is preferable for this type of the lesions. They show the better delineation and diagnostic. So these are the MRI images. We can see T1 contrast test and T2 clear images. We can see the lesion. But for the medulloblastoma complete with the imaging of the spine, this is very important. We are talking of the posterior fossa tumor, and there is a continuity of the CSF. So that's why the MRI spine is also very important. In this image, we can see the enhancement of these meninges, and there are some seedling of the lesion is also there. That's why the spinal MRI is also very important at the time of the diagnosis. There are some MR spectroscopy. What is the MR spectroscopy? Or the neurotransmitter based images are there, and people are doing MR spectroscopy images also, because these are posterior fossa tumor. One has to go for the audiometry. IQ testing is very important baseline, because once we are exposing this type of the children for the treatment, we should know the basic pre-treatment, what are the IQ scoring, and so that we know after the treatment. So definitely surgery is the backbone, and that is definitive treatment. We have to remove this tumor, but apart from the specific surgery, we have to take care of the CSF, like increased intracranial tension, and that's why the pre-operative ventriculoperitoneal shunt that has to be avoided, because we are already doing surgical resection recommended, and surgical resection will definitely relieve the obstruction by opening the CSF pathways. So it is actually surgeon decision, but most of the cases VP shunting are avoided, as these children exposed for the opening of this obstruction by the CSF pathway. So this is the imaging. You can see complete surgical resection, that is usually ideal, but I just wanted TAN technique, hold this painted area. This is the case of brain tumor medulloblastoma, where whole of the brain and spinal cord is being radiated, but we can see the normal structures are also getting radiation. But this is the IMRT technology and other proton therapies, where we can see the other areas they are usually avoided and they are not getting any radiation. So IQ, as I told, is very important with the higher technology radiation. Higher technology, that is with the protons or with the IMRT as compared to the 3D CRT, there is the minimal changes in the IQ and of the patient, and we can see this is a graphical representation. What are the doses going to the spinal cord or cochlea, or your like the organ of visions like optic chiasma. They are getting very minimal doses with the new technology. So this is the about we can see it is a teamwork. Once we are talking of the brain tumor, and I repeat, Dr. Meenu Gupta from the Healers Valentis Cancer Centre, Bijnor, it is actually a teamwork. This is not the one-man show, where we require the neurosurgeon, where we require the pediatric oncologist, radiation oncologist, our neurologist, our psychologist, our endocrinologist, our rehabilitation team, ophthalmologist. With this, I wish all of you very best World Brain Tumor Day, and with the intent to treat, diagnose these cases more and more, and the intent to treat these children to give the better quality of life. we have to take care of their quality, we have to take care of their functional outcome. And thank you. We will be meeting in the next lecture and education series. Thank you.